We've started in the last couple of years doing more and more cases with the Da Vinci robot, and as we are getting more and more comfortable doing the procedures, we're able to push the envelope a little bit. First, starting out, getting used to training and getting over the learning curve on the robot, it took a considerable amount of time to do a cystectomy, whereas when we do an open cystectomy, we can do that in 2.5 or 3 hours or so forth. With the reconstruction, it's 3.5 or 4 hours. Our first cystectomies took considerably longer, 5 or 6 hours, and then as you get that right back down to to 2.5 or 3 hours, then you can add more things to it, like more complex reconstructions. The advantages of doing a cystectomy, now people argue about a prostatectomy. The outcomes are the same for an open prostatectomy versus a robotic prostatectomy. In other words, they all go home in a day, and the margin status is the same, and the return to continence and potency are really the same on all the studies that you look at. With a cystectomy, by doing the dissection and the resection with the robot, there's much less insensitive fluid loss. In other words, when you have a big incision and the abdomen's open, as you're removing all this, there's a lot more fluid transfer and a lot more, there's a lot less of that with the robot. So the recovery time is a little quicker with the robot. If you take a surgeon who's done thousands of prostatectomies open and compare him with someone who's done, just started doing the robotic Da Vinci prostatectomies, the outcomes are the same. There's a learning curve for the robotic surgeon to learn it, just like there was for the surgeon who does them open, and the outcomes are pretty much the same. But in certain situations, the anatomy is such that I think the robot is very helpful, and the magnification, dissecting the nerves, all of those things are better done. So I think over the next 10 years or so, we will be doing more and more things, robotically. We've already seen that evolution with laparoscopy. We're doing more and more things laparoscopy that we never thought we'd be able to do, and certainly we'll be doing more and more things robotically.